What's going on, everyone? Wanted to make a video talking about something that is a real life story. It's kind of interesting. I'm not going to be looking here because I need to go drive home right now, but I'm going to talk as I'm driving. So whether you're listening to this as a Facebook Live or whether this is a podcast, real quick, go to demo.movenowyou.com and you can check out a pre-recorded demo that we have showing how our program works behind the scenes. So a friend of mine started working at a physical therapy clinic, and the interesting thing is this friend of mine knows a whole lot about our program, what we do, and he knows about the fact that we have a belt system and a 12-week transformation, and we have all these ways of engaging the patient, and that as chiropractors, we're not interested in just pain relief and short-term care for a symptom, but we treat the whole person, and so on and so forth. And the feedback that he's given so far, I mean, it's pretty new. He just started working at this PT clinic part-time. Is he said, yeah, they don't have any of that stuff, which doesn't surprise me because I know a handful of physical therapists, and there's nothing against physical therapists that I'm saying in this message here. It's just pointing out some of the differences. Now, there is a whole chapter in my book, which I know I started off telling you about a demo, and I want to tell you about the book, but you can still grab the book and we'll ship it out to you for free. It's book.movenowyou.com. So book.movenowyou.com, and go to the site. If the site's still active and up right now, it means we're sending out the book. If it doesn't take anywhere, it means we've stopped sending out the book for free. So jump on it and check it out, depending on when you listen to this message. But anyway, I cover a whole chapter in the book about the difference with physical therapy and chiropractic, because a lot of chiropractors might think, well, corrective exercise, functional movement, isn't that physical therapy? Isn't that what physical therapists do? And I say, wrong. It's not what they do. Here's how the whole system is set up. Let me just tell you in a nutshell. This is not 100% of the time. This is just the vast majority of the time. Okay. Also ties into a question a patient asked me the other day. They said, hey, how come medical doctors don't work side by side with chiropractors, but they do with physical therapists? And I said, you want me to answer that question for you? How much time you got, buddy? No. And so I explained this to the patient, and I'll explain to you what I said to the patient. So this is the way it works. Okay, are you ready? Physical therapists are medical doctors' little, I don't want to say the bad word, but they're kind of like at their disposal. I'll say it that way. All right, meaning they do what the medical doctor tells them to do, because the medical doctor, big old medical doctor man, has all the power, and they say, you have a shoulder problem, go do some shoulder range of motion and some rehab with the physical therapist for 6 weeks, and go in there, and then they'll report back to me, and then you'll be done. And that's just what they do. Why do they do that? Because they are controlling the diagnosis. They are dictating what body part gets worked on. And the physical therapist is just like, yes, master, I do whatever you say. And then they see this patient, they see him for 6 weeks, they discharge him from care. Does that patient know how to hip hinge? Does that patient have a thoracic mobility problem? Does that patient have maybe a dysfunctional squat pattern, which is gonna throw them right back into a screwed up shoulder issue when they start exercising? I mean, yes. But can they work on it under the little umbrella that they were just, lucky enough to be awarded to be able to get that 6 weeks of care that big old medical doctor said was okay? No, they can't. And if they do, it's not going to be covered, because it wasn't something that was delegated by the prescribing, the referring medical doctor. Now, there are some situations where everything I'm saying right now is not how it works. The vast majority of the time, it is how it works. I have multiple physical therapist friends that I've talked to. They will attest to the same thing. Okay, they're not really stoked about how the whole system works either. Some of them are so unstoked about how the system works that they decide to go outside of insurance, not take the majority of their patient base from medical doctor referrals, and then guess what? They can do whatever they want at that point. But that's very, very few, because they are so dependent on those medical doctor referrals. They just want to keep them happy. So why do medical doctors refer to physical therapists, not chiropractors? Because chiropractors, I mean, not to sound condescending to the PTs, but they can think for themselves and they can dictate and delegate what kind of care the patient does. And if they have something like a 12-week transformation or a belt system of functional movement like we do in Move Now University, they can create enough value and enough patient education that the patient is willing to continue care and pay out of pocket because they can see the huge benefit in it. In the PT model, patients are like, oh, it's not covered, I'm not doing it. And the PTs know it. And they don't have the background necessarily, nor the desire to have excellent communication or systems of education or engagement or whatever. It's more like, nope, I learned a technique, I'm going to do the technique on you, and if your insurance doesn't cover it and you don't want to come back, okay, see you later. I guess that person didn't get it. And it's like, no, you weren't able to really align with that person or really uncover what is it that drives that person to make them committed and want to transform their life and use your services as one of the vehicles to attain that transformation. So listen, I'm not trying to sound all nasty on this Facebook Live / podcast, but it gets me a little riled up because not that I'm upset at the PTs, but that I'm a little bugged with the chiropractors who just assume that patients are being taken care of the way that they should because physical therapists will pick up the slack or because they're seeing a physical therapist. Physical therapists will not pick up the slack. They're handcuffed by the freaking system. They are handcuffed by this. For the vast majority of them since about 1990. Okay, so love or hate what I'm saying, but you can go and try to confirm this information on your own. And I might be wrong in different parts of the country or the world, but from the sample size of everyone I've talked to and from the feedback that I got when I went through the SFMA certification, selective functional movement assessment, and I was there at a seminar with like 300 plus people, that 99% of them were physical therapists, a couple of them were athletic trainers, and then there was like 2 chiropractors in the whole room. This is what a physical therapist friend of mine at that seminar told me. He said, "Hey, all this stuff that you're learning, all the stuff that we're covering with all the functional movement assessment, as cool as it is, guess what percentage of the physical therapists here actually go back and do this in practice?" And I said, "How many?" And he said, "Probably less than 1." And I said, "Why is that?" And then he explained the same thing I'm saying right now. It's because one is they really can't, and it's not how they work necessarily unless they're solo, unless they do not work in some sort of established clinic that just relies on referrals from medical doctors, or in some magical land, maybe they've gone out and they've educated medical doctors on how they should be referring and prescribing things so they don't limit what the PT can do for the patient. But bottom line, at the end of the day, bottom line, the big picture is this. As a chiropractor, you can address segment, posture, and movement, and you can do it in a more comprehensive fashion for the non-acute extremity person if that's how you want to practice. Because for the most part, if there's an acute extremity injury or something that we see, we can take care of it, but a lot of times we'll take care of it from an alignment standpoint, and we might co-treat that person with a physical therapist, and then after a couple weeks of that, after they do all their one-on-one stuff for that exact issue that they came in with, then we get them back and start going into more global functional movement patterning progression with how we program out exercise and corrective rehab. Now, here's the deal. Chiropractors can take x-ray, okay? They can diagnose. They can actually get to the detailed root cause of the problem. They can see the joint. This friend of mine who's working at a PT clinic, he said to me, he's like, it's so weird that there's like this feud with chiropractors and PTs. I was like, dude, there's no feud. It's just explaining who does what, okay? There, I think in a lot of cases, is a feud of the PTs towards the chiropractors. Right next door to our clinic, for example, right next door, there is an orthopedic walk-in clinic, okay? They sub out some of their space to this physical therapy operation. It's a chain. A patient of mine went over there, was being seen for a hip issue concurrently while she was seeing us and going through a bunch of stuff. And that physical therapist started showing her some really, really basic stuff. And this patient of mine, who was an older lady, she said, I've already learned all that stuff next door. And is there anything else you could show me or do that's different than what I've already learned? Like, I've learned that. That was like the basics. I'm doing way more than that. And their responses, they said, chiropractors should never be teaching exercise. This is what they said. This is what the PTs told her. And I said, that is funny. She told me that. And you can guess what I did. I walked over there at the end of my shift, and all the PTs had gone home. And I haven't gone back since to talk to them, but I was going to go back over there. Not to be like, oh, what'd you say? But to go over there and say, hey, let's just talk about this a little bit. I'm sure you've worked with a lot of chiropractors that maybe don't really know a whole lot about exercise or any sort of corrective rehab or anything. Tell me, share with me what those experiences were. Okay, let me tell you a little bit about how we operate and how we're different, and maybe how we have patients that we can help each other with. And then you build that relationship. It doesn't have to be a feud. It can actually team up and work together. Like I said, I have a couple PTs in town that I work with that I refer patients over to. They refer patients over to me. And even though there's a lot of stuff that we do that is a little bit in competition with each other, we figured out a way to be able to spread it out so they focus on the stuff that they really like to do that we don't do, and we focus on the stuff that we like to do that they don't do. And it's good for the patient, and it works for both of us because we can both do what we specialize in, right? So anyway, this friend of mine who's working at the PT clinic, I'm sure we'll have some fun stories in the future to share, but for the most part, just to summarize what I'm saying is that chiropractors who assume that a patient going to a PT is going to get everything and anything they could possibly get as far as exercise and rehab and movement-based instruction from that PT is just wrong. Okay, in most cases, they're not. And the way we purposely programmed out stuff inside of Move Now University as far as our exercise programming, it follows the best science in functional movement rehabilitation, getting away from a joint isolation model, restoring these coordinated movement patterns, teaching patients like as soon as possible how to do things like hip hinge, how to breathe properly, how to engage their core, looking at someone that has a shoulder issue and saying, what's their thoracic mobility look like? And then segmentally saying, are they subluxated in their thoracic spine and where? And then posturally looking at the thoracic spine and saying, what is their thoracic curve? Is it within normal limits? Is it a rigid thoracic hyperkyphosis? How can we start to reduce that curve with thoracic extension traction combined with specific segmental adjusting, postural corrective exercise, and then patterning work addressing mobility, stability, and loading in functional movement. I know it's a mouthful, but that's the way we do things. That's the way we've programmed it out here. So anyway, with that said, comment below if you have a comment. Share this if you feel like it'll be helpful. If you want to stir the pot, send it to a PT friend and see if they agree with me or disagree. But either way, check out our demo. Okay, go to demo.movenowyou.com and you can see what we're doing behind the scenes inside of our doctor training platform, where to date we have over 130 chiropractors who are part of this program and growing. There is a need for this. There's a desire for this. If you're looking to integrate or implement something into your practice, it is not a medical integration. It's not buying some expensive gizmo where you can put lasers on someone's feet. What it is it's doing something under your scope of practice that's congruent with chiropractic. And guess what happens to be super congruent with chiropractic? Movement. All right. So hopefully this is helpful. Comment. Let us know what you think. Let us know what else you want to see. And we'll see you soon. Over and out.